Let's get into our next discussion now. The strike embarked upon by the National Association of Resident Doctors over unpaid salaries and benefits has entered its second day. The health workers are also demanding the immediate withdrawal of a circular removing house officers from the scheme of service. The doctors had embarked on an earlier strike in April, leaving many patients unattended to across government-owned hospitals in the country. The strike had been suspended about 10 days later after they met with the federal government representatives. President of the National Association of Resident Doctors joins me now to make sense of all of these issues. Dr. Uyilawa Okohesuyi. It's nice to have you join me, Mr. President.
Good morning, and nice to have you.
Your name is really interesting, and I love it. I like to pronounce it very well, Dr. Uyilawa.
Dr. Uyilawa
Okwahesuyi. All right.
Yes.
After the program, I will call to know what this name means. I know those names are really powerful and they mean very strong things. All right. Thank you so much.
Yes, thank you.
Great. I'll come to you shortly. I also have in the studio public health expert, Dr. Tuime Bawandu. It's nice to have you join me this morning.
Good morning, Mike.
You're welcome.
I hope you're enjoying the strike.
Well, which of the strike now? No Nigerian is going to enjoy no strike, I'm telling you. All right, let me get to President of the Resident Doctors. Now, they recall that your association was on a strike earlier in the year, and one feels that when you are suspending a strike, some of the issues would have been either attended to or addressed or agreed to be addressed, as the case may be. Talk to us, what is leading and prompting this strike at this time now?
Thank you very much. I'm Dr. Uyilawa Okwahesuyi, President of Nigerian Association of Doctors. We gave a strike ultimatum to the federal government on the 31st of January and had it reviewed again on the 31st of March, where we signed a memorandum of actions with the federal government. We also gave an addendum to that on the 9th of April. And the things pertinent on that strike notice ultimatum was: 1, payment of members on non-regular salaries under the undergiveness platform in 10 federal institutions that have not been paid for 3 to 6 months. And as this stands up to now, we're still having irregularities with their payment. They have not been captured into the IPC platform. The capturing, they have been verified by the budget office, and the capturing was stopped by the head of service. We also have members, the house officers, that have not been paid for about 3 to 6 months. The circular came out from the head of service, removing them from the scheme of service, and this was adopted by the Lagos State government, and they have since removed them from the scheme of service. These are trends that are terrible and worsening and causing problems in the health sector. Apart from that, we have members that are also being owed the Medical Resident Training Fund. The Medical Resident Training Act was put into law in 2017, and as part of training of doctors, they are meant to go for updates, go for exams. But I understand it was not even budgeted for, even when we had an agreement with them last year, 2020, and it was said to have been budgeted for in the supplementary budget, which we have not seen. As it stands, minimum wage arrears was also being set to be owed to us, and it was budgeted in the supplementary budget, which up to now we don't have any clue of what is happening there. There's the 2014, 2015, 2016 shortfalls and salaries. Up to now, we have signed an MOU, and nothing is happening there. On the other allowance is being paid at 5,000 naira to all health workers. And we agreed on that in 1991. Till date, we are still struggling with being paid 5,000 naira. Those are the issues we are facing now. And after signing the MOU, today makes 116 days, and still nothing has been done about all these issues.
All right, so basically this is about salaries, welfare, and allowances of resident doctors.
Not essentially. If you recall, we lost 19 members to COVID-19, And those ones, the government said they have debt and service insurance. But as of today, 18 months later, the next of kin have not got anything from the government. You have left breadwinners, you have left people that take care of their families, and nothing is coming out from it. You can also recall that in Abia State, they are in salaries over 18 months, Imo State 8 months, Ekiti State 2 months, and Ondo State 4 months. These are breadwinners also. And you say health is wealth. For someone that is hungry and not able to take care of their own basic necessities,
okay,
how would you prevent them from being active in the workplace?
Okay.
Hunger have killed more Nigerians and people all over the world than COVID-19.
All right, I'll come back to you.
Make them function properly?
Okay, I'll come back to you, Doctor. Let me bring Dr. Mibawondo in here. Now, if we talk about the difficult decision one has to make, where we know that doctors have an oath to uphold and save lives and all of that, yet we have a situation where, like Doctor said earlier, these are people's fathers, people's husbands, people also have lives. I'm referring to the doctors and all of that. But when they have an oath to uphold, to save lives, especially the innocent patient lying on the hospital bed, how do we balance that?
For me, let me approach this discussion from a perspective.
Okay.
Now, part of the responsibility of government, why we say, okay, we are surrendering our sovereignty to a government, is that you will respect us and honor agreements. Honor agreements. It's about honor. It's about fidelity. It's about trust. It's about me to be able to interact in a space where I know that once somebody subjoined over me, representing me, can be trusted, can be honorable, can do what he says he's going to do. Now, if you know you are not going to do something, why sign agreements? I'm telling you perspectives on why sign agreement. Now, if you bring the Speaker of the House of Rep, you bring a Minister of Health, you bring committee chairman of health from different houses to sit at the round table and say, guys, I am penning this thing. Trust me, you are going to get this amount of money. And you are not honoring that. What kind of governance is that? And this thing has been consistent 2013, 2010, 2013, consistently. Loss of honor. Now, if you look at the scorecard of Nigerian health system, here we are. 70% of Nigerians have to dip into their pocket to pay for health services. Government is not providing fund. Health insurance is not covering anything. Okay? That's one. Secondly, 20% of maternal deaths worldwide contributed by Nigeria. How do you explain that 20 out of every 100 people dying in the world because of maternal issues are Nigerians? 600 out of 10,000 infants are dying in a country. Malaria is killing 110,000 every year in Nigeria. It is an ongoing pandemic. Delta variant is ravaging us. And also, we have endemic. Cholera is killing. Lassa fever is there. Monkey virus came up. You see all those things. And the only game changer, because this is the scorecard of Nigeria health system, and the only game changer in this narrative is human resources for health. HRH, human resources for health. The arrowhead of human resources for health are the medical doctors. You are not honoring agreements. You are not funding health. You put 3.7% of budget on health. What would that do in reality? Immunization is suffering. People now, okay, vaccine is coming. Who are those who are going to give those vaccines? Okay, now you look at all those things. The recommendation is that you guys should have one doctor to about 10,000 people. Nigeria is having how many doctors to 100,000? About 4. 1 to 1,000. Nigeria is having 4 to. So what means that the gap of doctors in Nigeria is as much as 200,000 in a place where universities are perpetually on strike, where the training method is challenged. Look at the training of the resident doctor. It's challenged. Now you keep on, you put all these things together and you say, okay, wait a minute, I want to achieve this health milestone. I want to do this thing. Then the critical workforce that we are going to use to achieve that, you are treating them like this. You are dishonoring your own agreement. I mean, these are the fundamental issues, beyond the fact that, say, doctors need money and all those things. But these are the fundamental issues. How would I now be able to trust government that I put my hand, years in, years out, years in, regime after regime? We cannot trust. You see, sometimes I ask the question, are these guys on steroids? You see, what is going on? That I will put my hand, and I read all these agreements, I put my hand and sign that, listen, I have agreed, we are going to do this within so time. And I have to wait. This is like, last year about 4 strikes. This is another, second strike this year. It also has perspectives, because right now, you know what that means? It means that gradually, even those people that are putting their hands in their pocket to pay for their health services will not trust public health institutions. 42,000 doctors in Nigeria, 16,000 of them are registered. That's like half. Are resident doctors. So where is this going to come from? Some of us, if I really prepared to be a broadcaster, if you can allow me. So, so these are critical issues. What are we going to do? People will distrust health institutions. They will not patronize it. Like the recurrent strike in the university and education institution led to distrust of the educational institutions. And people are finding way, and they even find that education is not necessary. Are we signing death certificate by voting for democratic leadership?
All right. Dr. Dr. Uyilawa, let me call you that for the sake of this interview. Sorry. Now, let's talk about the meeting, because we heard there was a report of an engagement government was supposed to have to avert this strike. Talk to us about that, if you held.
We held a meeting with, we wrote a letter to all the people present, the Minister of Health, Minister of Labor, the Speaker of the House, of Senate, and the House of Rep, the Budget Office, informing them that we have a NEC meeting in Umahia on the 26th to 31st to determine the way forward on the ultimatum. We were called at the instance of the Minister of Labor, Senator Pisingige, who came and moderated the meeting, where the Minister of Health was also present, the PAMSEC, the Budget Office, and the IP's office. And we reviewed all this list I've given you earlier, and found out that apart from a name that was present in the death and service insurance, no other thing had been achieved. So he knew and told them that what have they been waiting for 115 days since we signed the MOU and nothing has been done. So that's the problem of Nigeria. You sign MOUs, you expect them to be responsible enough to follow up and get results. Instead, they come to the table again after 115 days, and they look as if it's a new thing that we're saying. These things have been recurring for over a decade. The last hazard allowance was reviewed in 1991. Insurance is not there. Salaries have not been paid for months, and you want the best to come out from these people. Each resident doctor you're talking about still their children go to schools, they pay rent. You can't say because you are a doctor they should waive your rent to be paid for that year. Or when there are children that have been sent home for not being able to meet up with payments, you can't tell them you're a doctor. Welfare of our members, we have lost. The welfare of their families left behind. The salary is not being paid for 18 months. You have to take care of your own self first.
All right.
Before you're able to render
now
talk
to us about the going forward now, because one way or the other, we still have people who are feeling the brunt, the weight of the strike on them, lying on hospital beds. What engagements will you be having with government going forward as a way of resolving these challenges?
As of today, as I heard the Minister of Health said, they are in contact with us. We gave them the strike notice since yesterday. We acknowledge copies. And I can tell you for a fact that we have not had any call from any of them as of today.
Okay. Dr. Mebaondu, some people say that these are some of the issues responsible for the brain drain that we have, where young men, people graduating from, graduating as medical officers, having their hopes outside of the shores of Nigeria and all of that. Talk to us about the long implication of things like this.
It's a strong push factor. Excuse me. It's a strong push factor in brain drain, okay? Because the strategy to train sufficient number, retain them, distribute them is key to health system. This is actually a discouragement, a big discouragement. Now, obviously, what is happening now is that we have to rethink the whole remuneration structure of the health system, the whole management structure of the health system. The key challenge here, somebody somewhere is not understanding the nitty-gritty of managing health workforce. It's not understanding it. So if we don't really have a deep conversation about this will continue. As it continues, it becomes very, look at the pandemic going on, for instance. It gets to a point that if your rate gets to a certain level, I will find it difficult to come and invest in your country. Because the critical workforce depends on the strength of the nation, the health of the nation as it is. So you don't worry, you see more people egressing from the country because of this, what I call the push factors, okay? You see more people. Now, no matter the amount of this thing you have signed, because you see, for our leaders, they have option of going abroad to take treatment. They can fly anytime. For our leaders, they have options of even paying in private hospitals, no matter the cost, okay? But for majority of Nigerians, that is a luxury. How would a Nigerian pay for the service of ENT, for instance, or oncology in a private hospital? It's going to be a challenge. And we're not, you see, because the resilience of the health system, the integrity of the health system is measured by how well you can actually deal with people that are challenged financially. It's a huge issue of access in terms of quality, access in terms of number, access in terms of time to health system. And look at what we're getting. Honestly, I don't just understand why it is not so clear. Maybe it's clear, but because you feel that, well, I am safe, I'm a leader, I'm safe, I have sufficient money stolen or taken, I can take care of my own anywhere in the world, I can charter air ambulance, then let the rest of the people go and run under the bus.
All right. We just hope that is not the situation, but we look forward to
that is the
greater
situation.
time.
That's the situation now.
Well, we just hope it's not.
Don't hope. This is the situation.
No, we hope it's not. Okay. Dr. Suyi. I think I have to get this name correct. I must get this name correctly. Suyi.
That's much better.
All right. Now the point there is, talk to us basically, going forward, what must be done and how long are you ready to go on with this strike before things are resolved?
Over the years, thank you. Over the years, we have tried to be patriotic, taking our patients first in everything we do. And we have been responsible enough to want to make things work, because we're not happy, we're not giving our best to patients. But I think at any critical time, we need to help the system to make the health system work. If you go to any of the zones in Nigeria as it speaks, you can't get the best quality health system in any of the hospitals. They don't have functional MRIs, functional CT scans, functional radiology, functional radiotherapy in treating patients. They lack the basic needs in the hospitals to function. And if Nigeria's resident doctors can help the country pay more attention to the health system, it's best we go for it and go all the mile. We are tired of signing MOUs, MOAs, and addendum to the Memorandum of Action We need actions to translate to work.
Okay.
And with that, we can call off the strike.
All right. We have to run it off here now. Thank you so much. Thank you so much. Unfortunately, we don't have the time anymore. President of the National Association of Resident Doctors, Dr. Uilawa Okwahesui, thank you so much for coming on the program. And I'm sorry I didn't get that name right at first, but this is a name I must get correctly. Thank you, Dr. Tuyeme Bawandu, for coming on the program.
My pleasure.
Thank you very much.